Wura. Hello from Mbantua country, home of the Aranda people, the traditional custodians of the land upon which Alice Springs sits. My name is Donna Chee, and I'm the CEO of the Central Australian Aboriginal Congress. Congress is an Aboriginal community-controlled health service based in Alice Springs. Since its establishment in 1973, Congress has developed a comprehensive model of primary health care, delivering evidence-informed services on a foundation of cultural responsiveness. I'd like to describe today how Congress led the response to increasing COVID vaccination rates to protect the health of Aboriginal people in Central Australia. From the start of the pandemic, Congress took COVID-19 very seriously indeed, because we know that Aboriginal people in the Northern Territory had already experienced many devastating epidemics as part of the process of colonisation. Our communities were vulnerable because of the high level of ill health, including chronic disease, poverty, overcrowding, and the distance to hospital care for many. We were particularly concerned about the threat of that COVID-19 posed to our elders. The loss of our elders would mean a loss of valuable cultural knowledge. As Pat Turner, the national leader of our Aboriginal Health Services sector, said at the time, they are the holders of our history and our knowledge, and losing our old people would be like burning down a library. As a result, we devoted considerable effort to developing a planned and evidence-based approach to preventing any potential outbreaks and ensuring our mob were protected when an outbreak did occur. Vaccination was at the heart of this strategy, and with the rollout of vaccines in early 2021, our job was to get as many of our mob vaccinated as quickly as possible. In doing so, we had to address a high level of vaccine hesitancy in the Aboriginal community. Sometimes this hesitancy was fueled by an historic distrust of the Western medical system, a distrust that even our own services can find hard to overcome. Sometimes it was due to misinformation. Often, though, we found not an opposition to vaccination, but instead an attitude of wait and see. After all, many people reasoned the virus is not here yet, and we can fix it with lockdowns if it does come. This same attitude was common in mainstream Australia before local outbreaks focused people on vaccination as the way to protect themselves and their families. Our clinical response to increased vaccination rates began with the establishment of the COVID vaccination clinic in Alice Springs and the promotion of planned and opportunistic vaccinations at all Congress remote clinics from March 2021. However, importantly, we didn't rely on people to turn up at our clinics to be vaccinated. We conducted an outreach program in Alice Springs town camps during July and August 2021 to try and lift vaccination rates for the at-risk communities. This was led by Aboriginal community engagement officers who worked alongside nurses to talk to our people in a culturally safe way and build trust. From September 2021, we also ran an intensive vaccination program with pop-up clinics in local shopping centres, at football games, and further outreach programs across public housing, hostels, aged care facilities, and town camps. This vaccination intensive program was supported by a financial incentive in the form of a $25 shopping or store voucher to be given to every client vaccinated. While we have not conducted a formal review of the effectiveness of the incentives, anecdotally we know that they were well received. Our impression is that some of those with a wait and see attitude were persuaded to get vaccinated rather than wait. However, it's clear that the greatest motivator for people to get vaccinated was when there were outbreaks and lockdowns in the Northern Territory. At the Tanami mine, for example, in July 2021, and in the Top End and Katherine region later that year. This is the same as what happened in mainstream populations when they had outbreaks. Throughout this time, we continued to consult with the community and to put evidence in front of them so they were able to make informed decisions about their health and the health of their families. During all this, health staff worked long, stressful, exhausting hours. They were our greatest asset, and we owe them all a great deal. It is thanks to their efforts that the number of infections and deaths has not been greater. There are two ideas that I would like to leave with you. First, the importance of culturally responsive outreach programs that can engage with Aboriginal families in the community to deliver vaccination and other public health programs. These need to be led by cultural and social expertise of local Aboriginal community leaders. Second, the COVID pandemic is showing once more that Aboriginal community controlled health services like Congress are an essential part of the Australian health system. As such, the sector needs ongoing resources to continue to deal with COVID-19 and potential future pandemics. Thank you.